Neurodive Corner, and today we're going to be talking about trauma-informed care, and how it affects those of us that are caregivers, whether formally or informally, for neurodivergent individuals. So let's just start with a very straightforward, we're not going to get into the weeds of what trauma is, but the definition of trauma is any adverse event that can trigger a somewhat exaggerated or irrational response. So trauma is not about the event. The event is obviously the catalyst. Trauma is about the response to the event, and how does your body process that aversive event. Or for example, when you're talking about children, they call them adverse childhood events. And it could be, trauma can be anything. Again, the focus is not about the incident. There might be incidents that for somebody else with more resource, they can process with no struggles whatsoever. Whereas somebody that's neurodivergent might not have the same amount of resource or tolerance. So that's what we're going to focus on. It's trauma is a response. It's a response that your body instinctively starts whenever you are confronted with a threat or a trigger. Okay? So today I want to talk about trauma, not from the perspective of our patients and the neurodivergent individuals. We're going to talk about trauma from the caregiver's standpoint, because this is something that doesn't get discussed and doesn't get talked about as much. But it is now more part of the mainstream, and people kind of like see the importance of being a trauma-informed care provider. So one of the things that happens when you are a caregiver or a care provider or a clinical care provider is something that is called secondary stress disorder. And it's exactly what it sounds like. Very similar to PTSD. It is a disorder that is created by the constant exposure to people that are experiencing trauma or to traumatic events on their own. If you are in health and human services, you will know that is one of the main features of our careers, is we are constantly exposed to highly stressful situations. That is our daily bread and butter. So obviously it can then trigger secondary stress disorders. Now, secondary stress disorder on its own is not something that is going to be super debilitating. If you catch it in time, if you practice self-care, if you practice debriefing with your teams, if you have peer support groups and things like that, you can catch it in time and you can address that secondary stress that your body is receiving because of the nature of your job. However, when you do not engage in any of the activities that I spoke about, like going to a peer support group or debriefing with your supervisors or even with your peers or with an official that is designated for those purposes. There are agencies that have departments that are dedicated to that. If you don't practice self-care, some sort of like mindfulness, you will then start to develop the worst symptoms. Therapeutic relationships can get blurred, and you're working with a patient or a consumer, a client, for an extended period of time, and now that relationship is in this weird gray area where there is rapport, there is a bond, there is attachment built. And whenever you see this person going through trauma, experiencing trauma, you are taking on that trauma as well, and you're feeling it as your own. If you're somebody that is highly empathetic, or you're a highly sensitive individual, this is definitely going to be magnified for you. If you are an empath, not an empathetic person, because everybody has the ability to be empathetic, but if you are an empath, a highly sensitive person by nature, sadly, you feel those emotions as your own. And if you do not create a space to process those, to metabolize them, they are going to start creating problems for you as well. So you are going to be experiencing symptoms that are very similar to post-traumatic stress disorder. And that's where burnout comes in. That's where fatigue comes in. That's where cynicism and feeling jaded, losing sight of your purpose. That's when all of these things start happening. Is when we don't know how to identify that we are exposed to a level of trauma that we are not metabolizing. And this happens a lot, and you see it the most, and people get a little judgmental even. You see this a lot with first responders and nurses. And I'm not including the nurses in the first response, even though they do fall into that. But obviously, if you're a nurse that is working a med surg floor or something like that, and not your emergency room, you're still exposed to the same issue. It's just the roles are a little bit different. But with first responders, people back in the day used to judge and always wonder why so many first responders and nurses are overweight. And now that we understand that your body keeps score, and there's actually an amazing book that's the title of the book, Your Body Keeps Score. And it talks about how trauma is not something that you can rationalize or deal with from a cognitive standpoint. I mean, you can address it and be self-aware, but you're not going to metabolize trauma with only that approach. There has to be a somatic approach. Trauma has to be experienced through your body because it gets stored in your body, depending on your personality, depending on your culture, depending on your role at work, depending on how much resource you have built or how little resource you have to process what comes with your profession. So one of the reasons why a lot of the first responders and clinical providers have these health issues like obesity, like high blood pressure, like AFib, is because they are not practicing self-care. They are not having any type of resource for their body to metabolize all of that trauma and all of that negativity that they're constantly exposed. So what happens is, obviously, your lizard brain gets engaged, and a lot of the hormones and stuff that needs to be balanced in your body get out of whack. Cortisol levels go up, and other hormones, your thyroid functions get messed up, your liver functions get messed up. All of this can happen over time when people are not processing stress and trauma the appropriate way and from a holistic and somatic standpoint. So anyway, I just wanted to share that with all of the caregivers out there. Make it a point to always do something for yourself every day. It doesn't have to be involved. It doesn't have to cost you money. You don't have to overthink it. just do something that brings you pleasure. Any little thing that brings you pleasure and helps you get grounded and feel like yourself and get back into your skin is going to help you avoid all of these issues. And there are tons of resources out there for those that are interested in becoming trauma-informed caregivers. So if anybody has any questions, leave them in the chat. Thank you to all of you that joined the video. Thank you for those of you that are saying that I'm smart. I appreciate you. This is more life experience than anything else. You know, I've been in health and human services for over 20 years now. So I appreciate all of you. And as always, like, share, and subscribe if you're interested in building solidarity and building community with neurodivergent individuals and the amazing people that care for them. As always, stay safe, stay healthy, lift each other, lean on each other, and I'll be talking to you guys very soon. Bye-bye.